Hello, hello, and good afternoon, everyone. I hope you guys can hear me. Just if you can just put a message. I'm just going to open this chat window and put it on the in the corner. So I hope I. Okay. Going to the next slide now. Again, I hope I am audible here. And the before I begin my session, before I begin my webinar, there is an announcement on behalf of Learn to Upgrade. Just one second, I'm hearing too much echo. Hi, I'm back again. Just give me one second. There is a little bit of technical glitch that I need to address to. Give me 1 minute and I'll be right back. Okay. I hope I don't get the echo. I've tried to fix the issue. Yeah, before we begin, hi, actually, good afternoon and hello. I'm Dr. Ashwini Ghate again. There is a special offer that Learn to Upgrade wants to extend to everyone. Once again, I have to see there is just too much echo. All right, let's see. Hopefully, third time is the charm. I once again, Dr. Ashwini Ghate here. Let's begin. There is a special offer that is being extended by Learn to Upgrade. So while during in the duration of this webinar, if you register on any of the Learn to Upgrade Learn to Upgrade courses, they are offering the 30% discount on the courses. Some of the courses that are offered are medical coding, genetic engineering using CRISPR, molecular docking, CAD. Of course, there are way more courses. You need to go to learntoupgrade.com and explore there. There'll be a lot more courses available there. And there is a coupon code that you need to enter. The coupon code is COVID30. Okay, so just a quick announcement. If you sign up for any courses during the duration of this webinar, there is a 30% discount. Use coupon code COVID30, COVID30, and there is a number posted here on the slide at the bottom. I hope everybody can see it. That's the helpline number. Okay, so let me begin. Okay. Yeah. So let me introduce a little bit about myself. As I have said before, I'm Dr. Ashwini Ghate. I am a doctor as well as a certified medical coder. I have graduated from University of Pune in the year 2000 with BHMS. And after moving to the United States, I decided to switch my career to the medical coding field. The reason for choosing this field was I wanted to stay in the healthcare field, but also wanted a stable, and a stable, office job. I didn't want to go back to the clinical side. I mean, of course, nothing against the clinical side. It's great. It's just that it was my choice at that time. And medical coding offered me that kind of field, like that job security and also the career growth that one is looking for when choosing a career. So that is why I chose medical coding as a career for myself. Then I worked in a company named Outcomes Health Information Solutions in the United States. And later, like after we moved back to India, I started I started training people. I started my first batch in 2016 to train people into medical coding. As of now, as of today, I have trained over 150 candidates. Many of them who have become successful coders. Many of them who have great, like working as medical coders or auditors or managers or various positions that one can hold in the medical billing coding field. And I have also a little bit of experience in IT field, as in I worked with a company that develops medical coding software using automation, using artificial intelligence. So I was like on an advisory team in that company. Currently, I'm working as a head of operations in a billing coding company named Buildability, and also, of course, working with Learn to Upgrade, giving courses and webinars. All right, so we'll begin. Now, one might have heard a saying that there is never going to be a. Actually, before I start with the session, if you have any questions, please hold on to them till the end of this session, or you can keep on typing them into the chat window. I have my eyes on the chat window, and if it is something quick, I may address it right away, or I am going to leave some time at the end of this session for Q&A. So definitely. Oh, you're not able to hear me. Okay. I hope this is better, because I'm on the maximum volume, and I hope this is better. So anyway, so might have heard a saying that there is never going to be a recession in the healthcare sector, and that is absolutely true. With modernization and literacy rates going up day by day, people are even more conscious about their health and thus investing in health insurance plans. This this significantly increases the demand for medical professionals every year around the globe. And of course, that includes medical coders and billers. Um, now, so let's start with a basic question that one can think about, and that I have shared on my slide. What is medical coding? Um, so, uh, Medical coding is a unique process of transformation of medical services, healthcare diagnosis, procedures into medical alphanumeric codes that are universal in nature. In simple words, it's a process of assigning medical codes to the diagnosis procedures found in the medical records. Now, so to explain a little bit further about this, the medical coders actually go through medical records that they get in the offices or hospitals. They identify important information like patient's diagnosis, or if there are any procedures performed in taking care of that patient, the drugs used, medical supplies used, etc. And then they match that information with the medical codes that go with it. So it's a process of matching these diagnoses and procedures with the alphanumeric codes. Now, as I keep on saying alphanumeric, yes, most of the codes are alphanumeric. That means it's a combination of alphabet and number, or in some cases they are simply numbers also. Uh, and they are universal in nature, as I have said. That means anywhere you go in the world, pretty much the code for a condition given is going to be the same. That means, like, let's say we take a condition like tonsillitis, the code for it is going to be the same anywhere, any place, any country that you go in the world. Okay. uh, so Again, like another slide to just depict what is medical coding. It's a transformation of medical services, healthcare diagnosis, and procedures into alphanumeric universal codes. Now, I mean, I have kept on saying that the medical coders have access to medical records, and they take all their data from medical records, and that's how they translate it, and then they translate it to medical codes. So, what is qualified as medical records? Now, by medical records, we mean doctor's notes, nurses' notes, radiology reports, pathology reports, transcripts from the doctors. So, how in India we have we go and see a doctor, and they write notes, they create our file. So that file is actually a medical record. Now, various people can also write, like it's not just doctor, it's the nurses or it's the ancillary staff that can also, who has access to those will write their notes. Then suppose a pathology test is run, then the report of that, the result of the pathology report also qualifies as medical record. Okay. So now the next question that naturally comes to anyone's mind, it's going to be like, why do we require medical coding? Why do we require medical coding? I mean, why can't we simply just give use of medical record? Why do we need to codify it? Why do we need to go through the hassle of giving the codes, then learning about it, and then just so much hassle? Why do we need to do that? So let's kind of dig into that question and see if we can establish some answers about on that. So the medical coding happens every time a patient sees a doctor, okay, or any healthcare provider for that matter. Now, just one quick note here. Throughout this presentation, I'll be using two words prominently: provider and payer. Now, in this case, provider means somebody who provides services. That means a doctor, a nurse practitioner, then a physician's assistant. They're all providers. Like in this case, this person wearing a lab coat, he's a provider. And of course, patient, we know who's the patient. And the other terminology that I will be using frequently is payer meaning somebody who pays for the services provided. Okay. So I think one more thing that I need to clarify here, it's a lot of information that I'll be giving that applies to US healthcare. Because currently, at least, this field or this kind of work is most popular in the US healthcare. So what I'm trying to say is, so it's not as simple as just going to a doctor in the United States. Like we go see a doctor, and you just pay for your services and you are done with it. That's not how the cycle works there. Pretty much every person has their own insurance, and the insurance is the one that pays for the services. Because when you purchase an insurance plan, it is an agreement between you and your insurance, and they are kind of giving you the guarantee that whatever medical expenses that will be incurred in the, let's say, next year, they will be borne by us. Okay. When you sign that kind of contract with insurance company, it is their responsibility to pay for your medical expenses. So that's why the payer in this case is insurance company. Okay. So now to get that payment directly to the doctor or provider, there is a lot of back-end work that happens, and medical coding is actually part of that back-end work. So a patient comes to the doctor's office, they give their insurance card. The front desk person verifies that all that information is correct. Then the patient checks the doctor patient sorry doctor checks the patient and creates a medical record. Okay. And that's how the medical record is kind of generated. And then that further a claim is generated, and that is submitted to the insurance company, and they are the ones who will pay. So coming back to what I was trying to say is, so every time in the Western world, every time uh, a patient is seen by a doctor or a healthcare provider, a medical record is generated. The healthcare provider reviews the complaints, patient's medical history, makes an expert assessment on what is the problem, what's wrong with the patient, and how to treat the patient, and then documents the visit. Now, this documentation is not only the patient's ongoing record, but that is like a license, or that is a method by which the healthcare provider or a doctor gets paid. Okay, so it is essential, it is so important to have a well documented case. That is literally the backbone of medical coding, to have a properly documented case. Now, I just, it kind of reminds me of one of the instructors that, while I was taking a course on medical coding billing back in the States. So that person would just, insist every time, like, if it is not documented, it did not happen. That they would keep on saying that if it did not if it is not documented, it did not happen. So what it means is medical documentation is immensely important. It is absolutely crucial to have everything that you do in the documented form. It needs to be documented. Okay. Now, so it is like a chain reaction. So accurate and complete medical documentation will lead to accurate and complete medical coding, and accurate and medical coding, and then when you have a case that is coded to its most accurate specificity, then it will give you, this will in turn result in fast and accurate and complete payment of the claim that you have generated for that particular visit or that particular patient's visit. So so when a medical so that is kind of that is the reason why it is so important to have a really well documented case. Now, uh, next, okay, so when medical and the reason for creating that well documented case and then properly coding it is, when the medical coder translates this documentation into medical codes, it is actually a way of communication. It communicates certain things with the insurance company or payer. Now, what are those things that are communicated? Mm, Number one is patient's diagnosis. So by diagnosis, I think all of us know what diagnosis means. So it could be tonsillitis, diabetes, fracture, or a condition. Actually, if you don't have a diagnosis yet, the physician hasn't diagnosed the case yet, but a patient is coming with certain kind of complaints, like you go to a doctor for headache, for backache, for cold, for fever. So all those are medical complaints, or conditions, or symptoms, or signs, or diagnosis. So number one that we are communicating is patient's diagnosis. Number two, number two is medical necessity. So what is the meaning of medical necessity? Now, by medical necessity, we mean uh, the service that is provided, was it really reasonable? Was it really necessary? Was it customary? Was it, was it really needed? That is what an insurance company is always looking into. So I'll give you an example here. So patient goes to a doctor with complaints like cold, cough, chest congestion. Patient is also running high fever. And so the physician checks the patient, and he or she, they decide that this patient needs chest X-ray. They are kind of worried patient may have some lung damage. So they give an order for chest X-ray. A chest X-ray has been shot, and a report is generated. Now, all this information, when it is going in the code forms to the insurance company, one might ask, somebody from that insurance payer side may say, "Hey, patient is coming for cold. Why did you shoot an X-ray simply for that?" So the answer to that would be the codes that will be given for fever, chest congestion, cough. When you have a case like that, that requires a chest X-ray or a chest CT, or something to look into the lungs of the patient. Okay, and maybe in the examination they write, oh, there were rhonchi, there were rales. So yes, definitely we needed a chest X-ray for that patient. So when all those things are represented or translated in the code form and communicated to the insurance company, that is creating that is opening a dialogue, that is giving absolutely correct amount of and correct kind of information to the insurance company, and that establishes the medical necessity of particular action that has been taken by the provider. So that is number two, medical necessity. Number three is treatments, services, and supplies. So by that means, what medicines were used. If patient was given only the oral medicines, were there any injections given? Was any syringes used? Was there a saline set? Was there like a catheter that was used? All these things are covered in the treatment, services, and supplies. Or if there was any, like any small procedure that was done, like whatever, lumbar puncture, or something that can be done in the office, or ambulatory service center, surgery center, or even the doctor's office. So these things are communicated, that is number three. Number four is any unusual circumstances or medical conditions. So to give example of of this, number four is like circumstances under which the patient came to see the doctor. So was the patient in distress? Was the patient if patient had any underlying diseases like diabetes mellitus, hypertension? Did the patient simply come walking, or did the patient come in a wheelchair? How bad was the complaint when the patient came? So these are special circumstances or certain conditions that are communicated when medical codes are given to the insurance company. And all that is given, all this lot of information is communicated in a matter of simple codes. We don't have to send papers and papers and papers worth of files to the insurance company. Okay. uh, Now, so what happens is when the payer receives this information in complete and accurate code forms, it leaves no reasons for the denial of claim, and the claim gets paid in a fast and accurate manner. Uh, so what I would like to kind of go further and say, as the in this case, the medical coder is literally acting as a bridge that connects the provider and the payer, or the doctor and the insurance company. So I have this slide of a nice looking bridge. Okay, just something fun. I hope everybody's okay this far. If you have any questions again, you can type them now. It's fine. I can address them towards the end. Okay. Then, I'm taking the bridge. One more thing that comes to my mind is like a musician who interprets the written music and uses their instrument to produce what's intended. Medical coder will go through the medical documents and provides the insurance company with what they're looking for, which is alphanumeric codes, which are universal in nature. Uh, so to answer the question of why medical coding, number one answer is medical coding is required for fast and accurate payment of medical services provided to the patient by the provider. Uh, So the challenge, however, in this case, the challenge, however, is going to be that there are thousands of conditions, diseases, injuries, and causes of death. There are also thousands of services provided by the providers and an equal number of injectable drugs, supplies to be tracked. So, a lot of different medical terminologies involved. Medical coding for everything, like, even a single term will have a lot of synonyms, acronyms, different names, different descriptions. So all those things, like this abundance of medical terminology, is actually being standardized by using this common language of medical codes. Okay, so medical coding standardizes the language and presentation of all these elements so that they can be more easily understood, tracked, and modified. Now, this common language allows hospitals, doctors, insurance companies, and all these three parties to communicate easily and consistently with each other. Nearly all private health information is kept digitally, and it rests on the codes that are being assigned by the medical coders. So, the next, or number two, answer to why medical coding is to bring standardization. That means creating a common language that is understood by doctors or providers, facilities, that is hospitals, or insurance companies. So all the parties involved in this healthcare scenario, all of them understand the medical codes. Okay, so this is a common language, and again, as I said, it's universal. Anywhere you go in the world, it's going to be the same. Okay. Uh, I just have one more slide I want to show next. So this is a slide for standardization, uh, creating a better communication tool, which are medical codes, pairs, facilities, doctors, the circle. I'm going to go back. Okay, just go back to this slide and then we'll go to the next slide again. Now, moving further, I still haven't answered this question completely, according to me. So there is more to it in exploring why medical coding. So medical coding derives from public bills of mortality that were posted in London in the 18th century. It was through correlating these that the doctors determined the causes of a cholera epidemic. It is even more vital now as the data gathered through medical coding is used in improving healthcare in general. The data derived from the codes are used to determine utilization, manage risk, identify resource use, build actuarial tables, support public health, and actions in general. Now, we have seen a direct result of this data being utilized by in the formation, in the research and development that went into the coronavirus vaccination. So to create a vaccine, of course, they needed a tremendous amount of data, and by actually working on that data that was gathered in the medical codes format, uh, scientists, we see the results. Scientists have been able to create a vaccine that is used all around the world now. Okay. Now that we have established that medical coding is absolutely essential and crucial to the operation of healthcare systems, let's talk about various types of medical codes that are used around the world. So, what are some of the codes that are used around the world? Now, medical coding is performed all over the world, with most countries using International Classification of Diseases or ICD. Uh, ICD is maintained by WHO, World Health Organization, and it's modified by each member country to serve its own needs. In the United States, I'll be talking more of United States for the reason that I gave before, that most of the work, or at least my specialization, is in the United States healthcare. That's why probably that is one reason, and also a lot of work that is available in India is for the US companies. So I will be focusing on that. So in the United States, there are six official HIPAA mandated HIPAA mandated code sets serving different needs. So just a quick remark here: HIPAA stands for Healthcare Health Insurance Portability and Accountability Act of 1996. Now, this is a law that protects health information. Another word or another acronym for this is PHI, Protected Health Information. So health information, as we all know, it's a sensitive information, it's a confidential information, it's the information that actually belongs to the patient or patient's family, or somebody who is the owner of that information, and hence that information needs to be protected. So in order to protect the health information, HIPAA came into existence in 1996. Okay. So again, coming back to the point that I was making, so different code sets that are available in the United States. Number one is ICD-10-CM, International Classification of Diseases. Currently, we are using 10th revision. CM stands for clinical modification. Now, this is used for coding the diagnosis or disease conditions in the patient. Number two is CPT, current procedural terminology. So CPT is used for procedural coding. So it's in the name, procedural coding. That means, minor procedures that are performed, like chest X-ray, for example, CT scan, or putting a catheter. So these are minor procedures that can be performed in doctors' offices or office suites. So those are coded using CPT codes. The next is HCPCS Level 2, Healthcare Common Procedure Coding System, Level 2. Commonly we refer to HCPCS as HCPCS for the ease of saying it. HCPCS is used for coding of medicines or drugs, medical consumables. Next is ICD-10 PCS. So again, it's ICD-10, but it's a procedural coding system. So this is used for procedures that are performed in the inpatient setting. That means in the hospital. That is ICD-10 PCS. Next is CDT, codes on dental procedures and nomenclature. So dental codes for dental procedures, dental visits, and 6 NDC, National Drug Codes. This is another system that is used for coding of the drugs. Okay. Now, I have I have given a lot of information so far about medical coding field. I hope I have generated some interest in most of your minds, and you're all probably wondering how do I start a career in this field. So it is really easy, and it is very much doable. It is easy to start a career in medical coding, since this field doesn't necessarily require you to have a medical or a clinical degree. um, the only however, of course, having said that, basic knowledge of anatomy, physiology, basic knowledge of medical terminology will definitely help one in better understanding from medical coding training point of view. The difference between people who come from life science background and people from other backgrounds is the knowledge of medical terminology. So if you are someone who is coming from a different background, non-life science background, you can, if you will need to dedicate some extra efforts and time to learn medical terminology, and you can easily enter this field. Plus, if you wish to do a certification that comes with it, then usually it's a 3 to 4 months of work, and you can do it on part-time basis, and that significantly affects the salary. The salary for certified coders is surprisingly higher. Then yeah, so definitely it's a great field if you want to start a career in this. I'll definitely walk you through the steps in doing so. And yeah, but you're probably wondering if we have, I mean, I have said that before also, but then the way to do, or the reason why we get this work in India is because of outsourcing. So the healthcare services outsourcing industry is evergreen, and India is their preferred destination for offshoring medical coding and billing work. There is an increasing demand for medical professionals across the globe, which means there is a good job stability and security. India is emerging as the hub for healthcare outsourcing, where coding is the most preferred option by professionals. In fact, 80% of the US companies outsource to India because, I mean, so many Indians have worked there, and, this has been happening for quite some time, and they do see value in outsourcing to India. With exposure to both IT and healthcare, the coders will find a new avenue to polish their careers. Professionals in this field are able to work. Yeah, I request everyone to please keep their microphones on the mute. Thank you. Professionals are able to work in a secure environment with plenty of growth opportunities. So if you're, someone who's looking to start a career into medical or into healthcare field, and if you have a life science background, then medical coding is definitely the right field for you. So, typically you don't have, again, as I've said before, you don't have to be a doctor necessarily. A life science graduate, so BSc or MSc in the biology field, microbiology, zoology, botany, all those people. Pharmacy graduates definitely can enter this field. Of course, doctors, nurses, like certified nurses, then physiotherapist. And if you're, again, someone who is not from life science background, but if you are interested in entering this field, you can definitely do so. You will need to learn the medical terminology. You'll definitely need to put in more efforts, more time into this, and you will definitely need to be certified. So I have actually trained people from commerce background, arts background, even engineers, to become certified coders, and most of them have become successful in becoming coders and also working a job. Since I'm on the CPC topic, let me elaborate a little bit about that. CPC is a certification in the medical coding field, one of the certifications. There are many. So CPC stands for Certified Professional Coder. CPC, it's an and to actually earn that certification, you will need to pass an exam. It's not just given to you. So CPC, I see a lot of questions cropping up. I'm going to ignore them for now. I'm like, I have like last probably 10 minutes of presentation, and then I'll address those questions. So yeah, CPC, you will need to pass the exam, and then only you will be awarded with a certificate. Now CPC certification is it's actually awarded at an international level. It's an international certification. It is awarded by AAPC. AAPC is American Academy of Professional Coders. They're based in the US. They provide this certification all over the world. India is also, of course, one of the countries that they provide these exams into. Now, of course, because a lot of work is outsourced here to India, billing coding work. Now they provide these exams. So yeah, the exams are actually provided on both, like online and offline basis. So they have actually they were always in person, like pre-COVID times, but since the COVID, they have started the option of online exams as well. Talking about offline exams, the exams are provided in most metro cities in India. Then online exams, you can find all the information. The details of it you will need to find on aapc.com. So this is an open book exam. There are 150 multiple choice questions. They're ranging from medical terminology, anatomy, different coding scenarios, all those things. And the hour or the time allocated is 5 hour 40 minutes. The passing percentage is 70%. Uh, that means you will need to get 105 correct answers out of 150. Yeah, I'm not going to say that it's an easy exam. It's not a cakewalk. You'll need to work towards it. This is this is something you need to work hard towards, and you will then nail it, and you will definitely nail it, but you need to work towards it. So um, yeah, again, it's an international certificate. So CPC, uh, the countries that it is usually accepted are USA, of course, Canada, UAE countries, India. There are some other certifications like CIC, certified inpatient coder, COC, certified outpatient coder, CRC, certified risk adjustment coders. These are some basic certifications. There are some specialty certifications like CASCC for ambulatory surgery centers. Then there is anesthesia coding and stuff like that. There are there's a lot of information available on aapc.com. Be sure to check that website. Whenever you have the time. So yeah, what are the opportunities in this field? So as we have established before, it is the most coveted career field due to the job security and steady career growth. According to the US Bureau of Labor Statistics, job growth in the medical coding field is double than that of other industries. The growth is expected to be 22% by 2026. And then talking about India, the job market for medical coders is increasing. Southern India already has like captured a large number of opportunities. There are a large number of opportunities available there. In western parts of India, there are a lot more companies setting up their operations. More offices and companies are opening up. Then, as the health insurance use becomes popular, I won't be surprised to see Indian healthcare system using medical coding as well for processing their insurance claims. Now, when that happens, that will literally open opportunities in every hospitals, every clinic, everywhere, and of course, insurance companies. Then you can start your work as a junior medical coder, and you can then rise up the ladder. You become senior medical coder, you become auditor, a TL, then you become a manager, so on and so forth. Okay. I'm sure all of you are wondering, how much does a medical coder make? Now, I have included biller, but I'm not quite sure about the biller salaries. What I know are medical coder salaries. So salary range for medical coder it's a wide range, of course, somewhere between 15,000 to 40,000 INR per month. Now, certification positively affects the earning potential in this field. Kindly mute yourself, please. Please mute yourselves, whoever is. Thank you. Certification positively affects the earning potential in this field. Now, specializing in certain, coding fields like surgery, the ambulatory surgery centers, ED, ENM, that definitely helps elevate your career. Okay. Again, as I have said before, you can rise up the ladder by becoming a TL, a coding manager, a coding auditor, so on and so forth. Okay. Now, as you grow up your ladder grow up in your career, people, I know people who are also making like 90,000 to 1 lakh per month, now, and the sky is the limit, honestly. So yeah, that is about the earning potential. Now, some more opportunities in the medical billing coding field are medical records coordinator, medical coding specialist, medical billing specialist, medical records technician, health information specialist, medical records clerk, uh, health information clerk, then medical record analyst, health information technician, medical billing manager, record director, so on and so forth. This is something of course, I took from internet. A lot of opportunities here. Now, I hope I have like really generated some interest in many of your minds. And if you're looking into joining a medical coding course, you can of course become a coder. You need, of course, in order to become a medical coder, um, you will need to learn about the this objectives and curriculum, what to expect in this field. Okay, so so the topics that are typically covered during this course are introduction of human anatomy. It's an explanation of different anatomical terms and body systems. Business of medicine is the topic that needs to be covered. Of course, understand and apply the official basic guidelines of ICD-10, CM, CPT, HCPCS. Then understand the ways to determine the levels of ENM. ENM is a very important kind of coding, and you'll need to understand the levels, code a wide variety of cases using CPT, ICD, and HCPCS. Apply coding conventions and strategies using when assigning diagnosis and procedural codes. Identify the information in parentheses. There is a lot of information in the parentheses that is provided in the books. Be able to understand and apply all the references and cross-references in the index and tabular list of ICD book. Identify information in parentheses, I already said that. Be able to understand and apply all references, cross-references in the index, tabular list of ICD-10 book. Provide mock tests to give you, feel of the real certification exam. So make sure that they're giving you at least some exam. And so these are the things that one needs to understand. One second. Okay, now two more things that you need to one second. I'm trying to I'm going to try and get this annotation away. I hope I can do this. Okay, got it. All right. Then so some more things that you need to understand, like yes, of course, these are the options, or these are the things that one needs to learn in that course. But then you also have to take a few more things into consideration, like what is your schedule like? Do you have time to commute to a campus, or would online classes better suit you? If it is an online program, then it gives you flexible options, especially in the current situation. Will the program prepare you for industry certification? Does the program offer personalized attention? Will the program help you develop skills and knowledges that you will need to start working as a medical coder or biller? Does the program include hands-on practices with medical coding systems or computer systems? Will the coursework cover topics that are commonly included in the industry certification? Will they offer any help with the resume writing? Will they help you with job search? What kind of financial aid is available? These are some more things that one can think about when thinking about joining this career. Then I would like to go a step further here, and also like to give you following qualities that one needs to have in order to be successful in this field. So decision making skills, I feel this is important for any career field, but it is more crucial, or it is rather crucial in the medical coding field, because that will help you analyze and diagnose the medical records to determine the best ways to code the medical records. You will need to have attention to detail, which is required to accurately record and code patients' data. Now, good communication and interpersonal abilities, even in high stress situations like billing discrepancies, rejected insurance claims. So these things are, it's very human to make errors, and there will be rejections. You will have to like kind of put up with the insurance company. So you'll need to keep be able to work under these stressful situations as well. You'll need computer skills, of course, such as word processing, spreadsheet, database, software, etc., etc. Okay. Uh, okay. Now, so yeah, that is kind of end of my presentation. I hope this has I've given you, or I've shared some useful information with all of you. Once again, I'm sharing the slide with the coupon code COVID-30. So there are still probably 10 minutes till 4 o'clock. And if you want, you can immediately sign up for any courses on Learn to Upgrade. The code that one needs to use is COVID-30, and there is a helpline number as well. I'll just repeat that number: 72900 85793. Okay. Now, last slide. Thank you so much, all of you, for attending. And questions. Yes, there are questions. One second. Let me take a sip of water here. There are already questions, so I'll just start addressing them. A lot of them are direct questions to me, so that's fine. Is it something similar to